As the headlines highlight yet another winter crisis in our National Health Service, it's crucial to examine the underlying factors contributing to increased pressure on emergency departments across the country. Recent reports reveal that many patients are flooding accident and emergency departments not necessarily due to urgent medical needs, but rather health anxiety, an issue that has compounded in severity since the COVID-19 pandemic. At the AM to PM Wellbeing Service, we believe it's time to address this challenge head-on and explore effective pathways to reframe how we approach healthcare access. The alarming comments from Dr. Omar Nafousi, a clinical lead at the Royal Berkshire A&E, underscore the pressing concern that many individuals visiting A&E simply do not require emergency care. This pattern echoes nationwide, suggesting that a significant proportion of patients are grappling with heightened health anxiety. With young people now presenting with minor symptoms, such as brief chest pains, understandably concerned they are experiencing severe conditions, the reality is that many may be responding to a heightened state of anxiety rather than a legitimate health crisis. This dynamic creates a crucial question: how do we better equip individuals to navigate their health concerns without automatically resorting to emergency care facilities? The answer lies in improving access to mental health services and promoting preventive care in a holistic manner. The increasing demand for GP appointments further attests to a societal shift towards heightened health awareness and, unfortunately, a surge in health anxiety. This spike has placed considerable strain on primary care services, where patients are presenting with self-limiting illnesses under the misconception that they require urgent treatment. As noted by Dr. Amit Sharma, this trend reflects not only a rise in health awareness, but also the psychological ramifications of living through a pandemic. At the AM to PM Wellbeing Service, we recognize these emerging patterns of health behavior and the pressing need to support individuals grappling with anxiety. Our mission focuses on providing comprehensive guidance and resources tailored to those experiencing emotional and psychological difficulties. By addressing the root cause of health anxiety, we can begin to alleviate some of the pressure bottlenecking our already overstretched health services. We urge the NHS and policymakers to reinforce the importance of early intervention in mental health care. By investing in awareness campaigns that educate the public about when and where to seek medical help, we can shift the focus away from unnecessary A&E visits and toward more appropriate care options. Instead of perceiving every health concern as a potential emergency, individuals must be equipped with the knowledge and resources to gauge their symptoms wisely. Encouraging a wait-and-see approach for minor ailments and promoting mindfulness surrounding one's health can effectively reduce anxiety and the impulse to seek immediate medical intervention. The observations shared by clinicians are challenging but necessary to digest. As we navigate the complexities of healthcare in a post-pandemic world, we must acknowledge that ending the crisis will require a cultural change within our approach to health and wellness. The notion that A&E is a first resort option for any health concern needs to be transformed to one where primary care and mental health support are the go-to sources. It is inevitable that further pressures on the NHS will arise, whether from winter illnesses or the current systemic challenges, including delayed discharges and staffing shortages. Still, we have an opportunity to mitigate these pressures through proactive mental health support and education aimed at cultivating resilience among individuals. In conclusion, the observations from frontline health professionals should act as a clarion call for all of us, encouraging an immediate dialogue concerning healthcare access, mental health awareness, and urgent care practices. At the AM to PM Wellbeing Service, we stand ready to support our communities in taking proactive steps towards better mental well-being, alleviating pressure on emergency services, and fostering a healthier society overall. The time for change is now, and together, we can make significant strides in redefining how we approach our health in times of crisis. Let's work to ensure that the next wave of patients arriving at A&E truly benefits from the care they receive, while also empowering individuals to manage their health concerns from a place of understanding and resilience.